Hello everyone, Dr. Lonnie here again today. Today is a video on day 5 after procedure. I am day 5 after my transplantation, and it's just wrap up like what we've been through and what to expect today. So up to this point, I've seen kind of an increase in swelling until about day 4, and my swelling, as noticed today, is starting to get better. That's normal course. Swelling increases up to day 4 and 5 and starts going away by day 8 to 10. I'm also noticing a little bit of itching and some sensitivity. Getting itchy mostly in the back of my head and in a little bit in the front, but not so much. Please watch our video on how to mitigate itching. There are some kind of tips we have to help out, such as mineral oil, more kind of the mist spraying, which is probably the best thing you can do, some hydrocortisone, and then maybe some antihistamine medications like Allegra and Benadryl that you could use. So in terms of my sensitivity, there's a couple spots in the back of my head where I notice just a little bit tender. I look back there and there's really no signs of anything. It's usually not a sign of infection or anything. It's just normal process. Maybe one of those punches we took out just got really close to the nerve, and that nerve is just irritated and inflamed right now. It's take a while. I also have a little bit of sensitivity up where my grafts are. Not as much as back pen. But oddly, I have sensitivity in the middle of my scalp where nothing was done, and this has never been brought up to me during for my patients, but really what it is like, it's just the nerves. There's nerves that travel up from your eyebrow area up to the top of your scalp. There's nerves that actually travel up from the back of your head, coming up to the top of your scalp. And the sites that we worked are actually within that pathway. So if you notice kind of like this weird sensation of kind of weird numbing, tingling, like I am on the top of my head, it's actually pretty normal. It just never come up in a conversation with the patient, but I thought I'd just point it out. I'm also noticing that a lot of my scabs are starting to fall out, and I'm seeing like these little hairs in there. That is totally normal as well. By this time, the follicle has been nicely seeing the scalp, and the shaft of the hair is actually dissociated from the follicle as part of the shock loss process. We know that you'll probably lose about 80% of your hairs during the shock loss process. Some will preserve. If you have micro-FUE, you might see a lot of them just stick around. It's kind of been interesting to see micro be better from that standpoint, among other things. But don't be afraid, seeing it in the sink or the shower. These hairs will eject themselves. 80% will come out within the first month. So going into what you should do today, I want you to continue the misting protocol. If you're having issues with swelling, I want you to watch issues with itching. I want you to watch the video on itching. You're probably going to be finishing up your antibiotics around this time. If you're on a steroid, you're probably finishing up the steroid around this time. You should definitely not be on any pain medication at this point. You might be taking some NSAIDs just here and there. That's fine. If you're having continued pain, please call us. It's not usual. In terms of vasopressin you would put in the back of your head, today's day 5 is the last day for that. Beyond 5 days, it can start causing irritation, and it could make that kind of itching worse. We like to get rid of it. Some nice things you can start doing today. Since day 5, you can start sleeping in a normal position. You don't need to be in the trial pillow. You can be on a normal pillow. Obviously, don't rub your head into your pillow. It'd be a little bit more gentle, but things are pretty nice and socked in. You can start light exercise, moderate exercise today. Light exercise we started on day 2. So moderate exercise, what does it mean? You can sweat, but you shouldn't strain. So jogging's fine, going out for a stroll, taking out the kids, doing yard work where you get a little sweaty, but you're not bearing down, pulling up a lot of weights and causing your blood pressure to go up. You don't want to do that. Today you can also start wearing a cap. There's a video on how to put on a cap. Basic principle there is just don't let the brim of the fabric of the cap touch your newly inserted hairs. It's totally fine to touch the area where the hairs were collected from. That's nice and hardy. Watch the video on how to put on a cap if you have any concerns, but basically it's just putting it on carefully, making sure it's not shifting around and touching those new hairs. With that cap, you can also go out in full sunlight now. Obviously, if you notice your head getting hot and that hat not being protected, either get a different hat or just kind of minimize that time in the direct sun. You're not at a point yet where you can put on spray and sunscreen in your hair, so we do want to be a little careful. If there's any questions you have moving on from this point, just feel free to give us a call. Hopefully the itching doesn't get too bad. Please do not scratch it. Just watch that video, and if it's just uncontrollable, please reach out and we'll help you get past it. Thank you very much.